Hi, good morning. I'm sorry, good afternoon, whatever. I don't know whether what time you're going to watch all this. Okay, fine. Let's start your pharmacology sessions. And I'm sorry that we're a bit late. I think all the other subjects, our second year subjects, are already started. Fine, no issue with that. No, don't worry. You remember that we were thinking about like how to start in a different way because you are in a small number, six numbers. So thought of starting with the Zoom, Google Meet, and all like. But the problem here in the department, the network is very feeble. Our Wi-Fi is very slow, so the live video interaction like Zoom or the Meet and all is very difficult. So finally, we landed up with a decision like record the PowerPoint presentation and upload either in the Google Classroom or YouTube. Okay, so we have two platforms. If the presentation is less than 200 MB, I think we can manage with the Google Drive or the Google Classroom. Or if it's more than 250 or 200 MB, I think you have to depend on the YouTube channel. We have a separate YouTube channel started for this session. Forget about that. We will inform you the platform one by one. So welcome to the Department of Pharmacology. I'm Dr. Mirshad, Associate Professor. As an introduction or introductory session, let's start with the introduction of pharmacology or introduction to pharmacology. So here we'll be discussing about various terminologies. Okay, various terminologies will be discussed. So here forget about the first objective and the last objective. Only we'll be discussing about the second objective. Okay, this is actually a lengthy presentation. I have concised only to the introduction session, and here we will be discussing so we'll be discussing the terms like what is pharmacology, what is pharmacy, toxicology, pharmacokinetics, pharmacodynamics, the chemotherapy, etc. All right, different terms which are you're going to be familiarized in the coming classes in the next 1 year, and of course not just 1 year. It will be useful throughout your life as long as you remain as a clinician or a doctor or an academician. So the third objective is basically is possible only when you are physically present over here, because as per our protocol at the end of the first session, first class, usually we take the students to the different part of the department, pharmacology department, and we will make an attempt to familiarize the sessions like research lab, clinical pharmacology lab, then pharmacy lab, experimental lab, etc. Okay, then simulation lab, we have a computer lab, we have different lab. Unfortunately, here we are in a situation we are having virtual classes by the online platforms. So we'll try to have this session maybe once you come back to the department, when you join to the department for the normal or the regular classes, for the physical face-to-face classes. Hopefully these issues, chaos will be settled. Once again, I welcome you all to the introduction section of pharmacology. This is going to be the first class, and we have plenty of classes to come. We have more than 15 classes under general pharmacology itself. So the pharmacology is classified into systemic pharmacology and general pharmacology. So general pharmacology discusses different general aspects of the pharmacology, which includes pharmacodynamics, pharmacokinetics, and adverse effects, clinical trials, etc. Systemic pharmacology is entirely absolutely attributed to the effects of drugs in the treatment of various diseases which affect the systemic parts of the systemic condition. One more point to be remember here is that here all the drugs are basically chemical. See, I'll take paracetamol as an example. You know that paracetamol is a chemical substance. There are certain limits where the body can tolerate the level of paracetamol. Beyond that, this can act as a toxic substance and it can produce severe hepatotoxicity because it's a toxic substance. So that's what I wanted to tell you, like any foreign substances which even maybe having psychologically important substances. Now the next one is pharmacodynamics. Pharmacodynamics. Very simple. In a single sentence, it describes what the drug does to the body. What the drug does to the body. So here, how does a drug exert its pharmacological action? Again, I'll take paracetamol as an example because paracetamol is a very familiar drug. All of you know well about paracetamol, its interactions, its uses and all in common life or the normal life. So here, when paracetamol is consumed by a person who is having fever, after a few doses, maybe 1 or 2 doses, it bring down the elevated body temperature. Okay, paracetamol never reduce the body temperature. It only bring down the elevated body temperature and normalize the body temperature. So how does paracetamol produce this effect? What is the mechanism? This is what pharmacodynamics deals with. And it is the physiological and biochemical effects of drugs and their mechanism of action. That is an elaborative definition of pharmacodynamics. In a simple word, you can say what the drug does to the body. What the drug does to the body. And here I have got one more example. Adrenaline. It's a neurotransmitter as well as it acts as a endocrine hormone, and generally adrenaline produces vasoconstriction by acting on the alpha adrenergic receptors. And pharmacodynamics is something like how does adrenaline produce vasoconstriction? It acts on alpha adrenergic receptors and produce vasoconstriction. This is what the term pharmacodynamics refers. Next is pharmacokinetics. Pharmacokinetics is something like the word kinetics denote the movement of the drug. So here we consider oral administration. A drug is being taken orally. First movement is across the intestine or across the epithelial cells and it get absorbed. So that is the first part of the pharmacokinetics, absorption. And then various after absorption, it is get distributed and bind with the plasma protein transporter, metabolized and excreted. So all this comes under pharmacokinetics. Now here you can say that similar like pharmacodynamics, what the body does to the drug means what is the fate of a drug and what is the reaction takes place. What are the body's reaction to the drug? What the body does to the drug. This is what we are discussing under pharmacokinetics. I hope you could understand the difference between pharmacokinetics and pharmacodynamics. And the points to be remembered under pharmacokinetics are absorption, I already told you, distribution, binding, metabolism and excretion. Eventually, being an exogenous substance or xenobiotic, it need to be excreted or eliminated from the body. Okay, so the final step is excretion. So all these comes under pharmacokinetics. We will be discussing pharmacokinetics as a separate session in detail. All right. Next term, definitely, when we talk about pharmacology, drug is a term you should read along with the term pharmacology. So WHO has given a beautiful definition for the term drug. A drug is any substance or product that is used or intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. And here they have added one term is like to be used or to be modify or explore physiological system. I'll explain with an example. See, oral contraceptives are the drugs which are taken through oral route for the prevention of pregnancy. And you know that pregnancy is not a pathological state, it's a physiological condition. And the oral contraceptives are used to prevent pregnancy. There, this definition includes that session also. That's why they have added modify or explore physiological system. Apart from this, it is also used for the diagnosis, prevention, and treatment of the pathological condition. So this is all, it's a comprehensive definition. It covers almost all the type of drugs. Okay. And please remember, the term drug here denote the medicine. Sometimes what people synonymously use a drug and narcotic agents, illicit drug use, drug trafficking, etc., etc. So please remember, the term drug here refers entirely different. Hope you could understand. Now the next one is something called pharmacotherapeutics. The term is called pharmacotherapeutics. So here, see, if a person is familiarized with the pharmacology, see what is a medicine, like what are the steps of, like how this medicine is used and introduced, or how these medicines are invented, then what is the dosage forms, compounding, dispensing, etc. But pharmacotherapeutic is something like a combination of the two terms. Therapeutics means knowledge about the disease or the pathological states, which combine with the knowledge about the medicine. See, if a person should know both about disease and pharmacology. So this can combine and it can apply on the therapeutic context. So this is application of there's a spelling error. It is THE. Application of the pharmacological information together with knowledge of the disease and its prevention and cure. Okay. So a person in pharmacotherapy should know or should have the knowledge about the therapeutics as well as pharmacology. Next is clinical pharmacology. Next term is clinical pharmacology. See, the prefix clinical refers the use of a medicine or use of a drug in human beings. And this is a sort of study. See, clinical pharmacology is a study about the scientific study of drugs in man. So usually there are different scenario or contexts where a drug need to be studied in human beings. So first is something like a clinical trial. See, I hope all of you are aware about the term clinical pharmacology or clinical trials. So this is a study of the drugs in human beings and the pharmacodynamics, pharmacokinetics, toxicology, and various aspects of a drug can be studied in human beings in clinical pharmacology. Okay, so generally when a drug is studied, it is used as many preclinical animals, isolated tissues, then computer simulator models, or other bioinformatics tools are used. All these are collectively referred as preclinical pharmacology of preclinical study. So that's different from clinical pharmacology. Clinical pharmacology is something which is completely related to the study or the scientific study of a drug in the human beings. Hope you are with me. Next is chemotherapy. So generally, I know that now the term, like you will think that this is a very familiar, very commonly used term. Generally, a common man think that this is something like a treatment of cancer or malignancy, isn't it? People usually have an impression that chemotherapy is something, those drugs which are used for the treatment of cancer. But in pharmacology, there is one more addition along with the treatment of malignancy or cancer. Here, chemotherapy refers treatment of systemic infection also. This is an addition in pharmacology apart from malignancy, treatment of malignancy. So systemic infection, example, tuberculosis, HIV infection, leprosy, etc., or meningitis, then respiratory tract infection, urinary tract infection, all this comes under chemotherapy. So the antimicrobials like aminoglycosides or penicillins, cephalosporins, all comes under chemotherapy. So that is the difference between the chemotherapy under the impression of a general population and in pharmacology. Okay, so the similarity here, both both agents, means antimicrobials and anti-cancer drugs, are precisely specific to the malignant cells or the pathogens. Okay, so that is the similarity between antimicrobials and anti-cancer drugs. So this is the term chemotherapy refers here. All right. Next is pharmacy. Again, you all well familiar about pharmacy, and in fact some people may have a confusion in the term between pharmacy and pharmacology, and I have already told you what is pharmacology. When you come to pharmacy, it is an art. Okay, it's an art and science of compounding, like usually in olden days, a person under the guidance of a physician usually prepare the drugs. See, till maybe last few years, we used to have, in fact, for the dental practical, we still follow that compounding pharmacy, preparing toothpaste, tooth powder, shark liver oil emulsion, then various other formulations used to compound in the pharmacy. And this is the same way people used to prepare in the pharmacies. See, some term were there like compounder, doctor and compounder. Compounder is something, a person who compound the formulate the drug. Okay, now that post is not there because it's readily available. In fact, compounder turned to become pharmacist. Okay, and apart from compounding, dispensing is also part of pharmacy. So dispensing and formulations. Now pharmacists are well aware about the storage, different formulations, like what's the difference between emulsion, suspension, syrup, tablets, capsule, sustained release tablets or capsule, or extended release preparations, etc. So all these are the cup of tea of pharmacist, and it comes under pharmacy. So please remember and please try to understand the difference between pharmacy and pharmacology. Pharmacology is something which we discuss in depth about the medicines, its actions, its adverse effects, its clinical uses, etc. All right. So this is pharmacy is mainly focused about the compounding, dispensing, etc. Now the next term is something called toxicology. See, part of toxicology you may discuss in the forensic medicine also, isn't it? Forensic medicine also cover part of toxicology, and part is in pharmacology. All right. So it is a study of poisonous effect of drugs. See, you know that all drugs are chemicals or foreign substances, and any drug which are commonly used act as a toxic substance. There is a saying in Malayalam, Amidamayal Amradom Visham. This is applicable in case of medicine or the drugs, because we calculate doses of various drugs based on various studies. That is what clinical pharmacology does. We examine the toxicological dose, toxicities of the drugs, and etc. So beyond that particular dose range, most of the drugs, in fact all the drugs, act as a poisonous substance. So we, in toxicology, we discuss the toxicology or the poisonous effects of the chemicals like drugs, emphasizing its detection. See, pharmacology covers the detection of the poisonous substance. Sometimes what happens, some drugs are poisoning of some chemicals of the drugs may lead to some changes in the body. Say for example, organophosphates. It is very commonly used pesticides in agricultural field. Okay, so in India, it's very common that organophosphate poisoning. It could be either due to homicidal or suicidal attempt or accidental, whatever. So if a patient bring to casualty or the emergency department, some features slightly leads to the diagnosed detection. Say for example, pupil size, pinpoint pupil size will be very small. It is one of the feature, and BP, then many other features can lead to detection, and detection is also possible with examining the urine, blood, etc. Okay, or respiratory system, cardiovascular system, and other system. Okay, so that is what detection denotes. Now prevention. See, suppose if a patient say for example, like suppose if a huge tragedy had happened. Huge tragedy Malayalam, it is Madhya Durandam. Okay, a person is being consumed with intoxicated methanol, and it can lead to various toxic effects, including the first effect will be blindness. Okay, it can mainly affect the optic nerve, and person may goes to complete blindness. So like as early, like as soon as the patient is being brought to the casualty or the emergency department, like it's a confirmed case. So what are the things they will do? They will try to prevent further absorption, maybe by gastric lavage and all this is possible. And also some of the antidote may be used, like ethanol, ethyl alcohol is used to prevent further absorption. So prevention of poisonous effect by several means. It depends. There is no shortcut methods. It depends on poisonous substance. What is the poison that's causing agent? And treatment. See, if at all the absorption is already taken place and it's already in the blood or the system is circulation. So prevention could be due by supportive measures like respiratory support, or alkalinization of urine, cardiovascular support, fluid, something like that, or the antidote. All these comes under the heading of toxicology. Now we have something called drug nomenclature. So nomenclature is something about the name, related to name, isn't it? So generally, as a undergraduate student, we should know like what are the different types of names of a drug. So the first one is chemical name. There are three important name of it for a drug. One is chemical name. Okay, chemical name is something like then second one is non-proprietary name, and third one is proprietary name. It's also called brand name. So let's see what are the difference between these terminologies, the terms, difference in the names. Okay, so the first one is chemical name. Basically, it is least important as far as a medical student or the doctor is concerned, because it's only used, or it is used only in the research purpose. Okay, so example is propranolol is a beta blocker commonly used for the treatment of hypertension, and its chemical name isopropyl amino 3,1-naphthyloxy propan 2-ol. Again, you can also search what is the chemical name of paracetamol. You can search in the Google and find out a very lengthy name, and imagine what would have been happened if you are prescribing chemical name in your routine prescription. It would be a Herculean task remembering these lengthy name. This lengthy name is a Herculean task. So that is what chemical name. It's only for the research purpose. All right. The second one is non-proprietary name. Okay. So non-proprietary name is very important as far as a MBBS student or a medical student is concerned, because this is a name you're going to use for all the purposes, for your examination purpose, and this is uniform everywhere in the world. See, paracetamol is paracetamol in India, Europe, etc. But I have some exceptions to tell. See, atropine or morphine, aspirin, everything is same across the globe. But still, I wanted to. That's what I have to discuss some exception in this regard. See, I told you paracetamol. Paracetamol actually across the globe it's called paracetamol. Everywhere it's paracetamol. But in US they refer as acetaminophen. Acetaminophen. Okay. And similarly, pethidine is actually an opioid. An opioid used as analgesic for painful condition. But in UK they call pethidine as meperidine, MEPE, meperidine. Okay. So, and similarly lignocaine is a local anesthetic. Everywhere lignocaine is lignocaine, but it has one more name. It's called lidocaine. Lidocaine, lidocaine. So I have some exceptions for this, but still it is actually approved by the certain organizations, and the name is there in the pharmacopoeias, that is the books which describes each and A to Z about the drugs. So it will be same across the world, except those exceptions which I have mentioned now. Third name is proprietary name. It's also called brand name. See, again, I may quote one more example here as paracetamol. See, paracetamol is available as Vamol, Crozine, Panadol, etc. So all these are paracetamol. So these brand name or proprietary names are assigned by manufacturers. Okay, so if I own a pharmaceutical company, I can assign a particular name for paracetamol if I am marketing or if I am producing paracetamol. But usually manufacturer think, or they will try to assign catchy and easy remembering names. Okay. So one example I have given, atenolol is a beta blocker used as antihypertensive for the treatment of hypertension. Now in different countries, or even in one country, more than one brands. See, Altol, Adcard, Atacor. All these are the brand name of the atenolol available across the globe, and it is atenolol only. So similarly, you can find various brand name for each drug. You can also find out. Okay. And one more thing I wanted to tell you, apart from these three names, chemical name, non-proprietary name and proprietary name or the brand name, there is one more name called generic name. See, generic name is basically denote its group. Say for example, see, ibuprofen. This is actually aspirin or acetamine mefenamic acid. These are the drugs which are commonly used as analgesic for the treatment of pain or anti-inflammatory for the inflammatory condition. All these belongs to a group called NSAID, stands for non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. Similarly, see captopril, enalapril, ramipril, etc. These are the again drugs used for the treatment of hypertension. Okay, and this is something like belongs to a group of drugs called angiotensin converting enzyme inhibitors, ACE inhibitors. So ACE inhibitors or NSAIDs are basically the generic name of this drug. Okay, it denote the group, so which is not very important. That's why I didn't include this is under the drug nomenclature. Okay, so that's all about the first session. Now this class will be posted, and after this class we will be posting a Google form quiz. Okay, a Google form quiz comprised of 10 questions, and each will carry some particular mark, maybe 5 mark each for each question, so 1 mark. And to get attendance, to make sure your attendance, you have to respond timely, and this will be given to you through Google form, and the Google form through Google class, and that Google class code will be distributed among yourself, and you can go through. And now I just want to have one more thing. Being a first class in pharmacology, need your feedback. Okay, I need your feedback that you can inform your class rep Sandra. She can WhatsApp me. Then accordingly, if possible, we can make some changes in the future classes. And please remember what happened, like we have tried to conduct this class in different platforms, including Zoom or Google Meet, etc. But unfortunately, our network speed, both in my residence and the department, is very slow. I don't know why. It is happening since last 1 month. So unable to conduct the class. I don't know. Hopefully will be. This will be rectified soon, so that we can have some face-to-face interaction, interactive session soon. So please read and listen this class and read your textbook. And I hope you could follow. You are enjoying the class. Let's see what can be done for further improvement. Thank you. Thank you for your patience, and thank you for listening.